And 25% of babies born by mothers with HIV in the country miss being screened for the virus. Only 75% of them get screened at birth. The reason has been attributed to lack of due diligence on the part of caregivers. Sarah Apenkro reports.
99 out of 4,655 babies screened have been diagnosed HIV positive this year, according to data from the Ghana Health Service and the National AIDS Control Program. Every HIV-exposed infant must be screened for the virus after birth to ensure early treatment following their slim chances of survival. But not all of them get screened.
Whenever a service provider sees a pregnant woman who has delivered, you pick the client book. If the woman is HIV positive, then you are supposed to ask whether the child has also been screened. There's a challenge when it comes to that. It's not being done optimally because sometimes the service providers, they are overwhelmed.
The low level of health-seeking behaviors of men is also another indicator which is of concern.
162,000 who are on medication. And you have more males who are on the medication, but you have some of the males who are also on the medication. But when it comes to the area of testing, the group who are having a lot of them not knowing their status is the males.
Participants at a stakeholders workshop on rethinking HIV/AIDS interventions for key and vulnerable populations called for intensified capacity building to optimize available resources at all levels.
Yes. We are also asking for improvement in our coordination leadership to make sure that resources that we have can be optimized.
President of the Ghana HIV and AIDS Network, Ernest Orton, is worried efforts at reducing new infections over the years has yielded little results.
Do we still look at these young children and assume that they were promiscuous before because they got HIV? No, that cannot be. So we need to rethink how we look at HIV from that perspective. 262,042 persons with HIV/AIDS as of June were on antiretroviral therapy.